Having an operation in another country could be quite daunting. You don't have your usual support network, and you will be worried about what to expect. You may not know the system, and you will have lots of questions about the logistics, and you want to know what to expect in the days and weeks coming up to your operation, during your hospital stay, and then afterwards. So I thought I'd do a video to try and cover that. We have been treating an increasing number of patients coming from abroad to have their procedures at the Lister Endometriosis Centre in London. And they do that for a variety of reasons. I just operated on a lady from Canada. In her case, the problem was not that there were no experts available. In fact, she had one of the best in the world, but the issues with the waiting and the COVID meant that the waiting lists were too long, hence the referral. In other cases, there may be an issue with the availability of the service that can provide the sort of complexity that a patient, complexity of surgery that a patient may need. An endometriosis center is not just about one surgeon, it is about having the right sort of people, the multidisciplinary team, the colorectal surgeon, the urologist, and other specialists that work together to do complex surgery. So in some cases, patients choose to come to us because they want to access that kind of multidisciplinary team. When I speak to patients who reach out from abroad, that's the first thing that we explore, really, to see if it would be possible for them to have their operation more locally. So if I know someone that I trust in their country or closer to their country, I will always talk to them about the possibility of getting a referral to that specialist, but that's not always possible. So what we try and do is to try and minimize the number of trips that the patient needs to make to London. If they have been seen by a specialist that I trust, then it's possible that actually I don't need to see them face to face until a few days before their procedure, like it was in this lady's case. But sometimes I need to examine the patient before we can finalize the decision. There are situations in which that we can get enough information from the imaging, such as MRI, to make a provisional plan at least. What we will normally do is we transfer the images across, we discuss them in our multidisciplinary team meeting, and our radiologist, who is an expert in the field of endometriosis, will read the images, and then we'll have another virtual consultation, and that means that we can get closer to a decision. When the decision is made and we've decided that okay, we need to operate, then the HCA hospitals have a very good service that can look after the needs of the patients who come from abroad. That can include things like accommodation or help with logistics. Perhaps more importantly is our specialist nurse, who is really the first point of contact for the patients, all our patients, but in particular those who have more needs and requirements, such as our international patients. So she will contact the patient and will go through what to expect, and will give them a good idea of things that they're going to need, and will make suggestions about arrangements that they will need to make. Normally, we would recommend that international patients will stay in London and preferably close to Chelsea for at least a couple of weeks, particularly if they are planning to go back with a long haul flight, like was the case for this lady. This is partly because of the risk of DVT, deep vein thrombosis, when you go on a long haul flight shortly after your operation, and partly to make sure that if there are any issues, we can help with those instead of you having to go back to your own country and then explaining to your local doctors what operation you've had. So if you have that possibility, that would be great. For short haul flights, again, 10 to 14 days would be a good length of time after the operation, but of course it would depend on the complexity of the procedure. If you've just had something like a segmental bowel resection, it may be advisable to stay for a slightly longer than that, so that we can actually see you, examine you before you fly back.